Let's start by understanding disabilities. Over 15% of the world's population has a disability. Many of these disabilities are invisible and can't easily be seen. Disabilities can be physical, sensory, or neurological. They can affect a person's mobility, vision, hearing, speech, or cognition, among other things. Disabilities can be congenital, present from birth, or acquired later in life due to injury, illness, or aging. It's crucial to remember that disabilities don't define individuals. They are just part of who they are. Disability etiquette refers to a set of guidelines and respectful behaviors when interacting with individuals with disabilities. It aims to promote inclusivity, understanding, and equal treatment. Etiquette plays a vital role in creating positive and respectful interactions with the disability community. Let's explore some essential etiquette guidelines. Person-first versus identity-first language. The use of person-first or identity-first language is a personal choice and varies from person to person. While one should always use the language preferred by a person when referencing them, situations sometimes arise in which one does not know what a person's preference is before referencing them. In these situations, use person-first language. Note, some communities tend to prefer identity-first language. For example, many people who are deaf prefer to be referred to as a deaf person. The same is often true for those in the autism community. When possible, avoid making an assumption and don't be afraid to ask if someone prefers person-first or identity-first language when referring to them. Ask permission. Avoid making assumptions or taking over without consent. Always ask for permission before giving assistance, touching mobility aids, such as wheelchairs, canes, or service animals, or providing support. Respect their independence and personal space. Avoid pity or patronizing attitudes. Treat individuals with disabilities as equals. Avoid using a patronizing tone or expressing pity. Respect their autonomy and acknowledge their strengths and achievements. Just like with anyone else, respect personal boundaries. Avoid touching individuals or leaning on assistive devices such as wheelchairs unless given explicit permission. Be open and flexible. Understand that everyone is different and has unique needs. Be open and flexible when accommodating requests or making necessary adjustments to ensure inclusivity and participation. Use appropriate terminology. Be mindful of using appropriate and respectful terminology. When in doubt, it's always best to ask the individual how they prefer to be referred to or described. Include everyone. Ensure that individuals with disabilities are actively included in conversations, activities, and decision-making processes. Make an effort to engage and involve them to create an inclusive and participatory environment. Focus on abilities, not limitations. Engage in conversations that focus on the person's abilities, interests, and experiences, rather than dwelling on their disability. Treat them as a whole person, just like you would with anyone else. Practice respect and dignity. Treat individuals with disabilities with respect, dignity, and equality. Avoid patronizing or talking down to them. Show genuine interest and respect for their thoughts, ideas, and opinions. Offer assistance. Be proactive and ask if someone needs assistance. Respect their decision if they decline, but be ready to provide support when needed. Be creative in providing assistance if necessary. Overall, disability etiquette is crucial for promoting inclusivity, respect, and equal treatment for individuals with disabilities. It helps create a more accessible and inclusive society where everyone can participate fully and be valued for their abilities. By embracing disability etiquette, we can contribute to a more equitable and understanding world for all. Now, let's review best practices when interacting with individuals with different categories of disabilities. Physical disabilities refer to conditions that affect a person's physical functioning, mobility, or dexterity. Physical disabilities can vary widely in their severity and impact on daily life. They may affect a person's ability to walk, use their limbs, maintain balance, or perform tasks requiring fine motor skills. Assistive devices such as wheelchairs, crutches, prosthetics, or mobility aids are often used to enhance mobility and independence. People with physical disabilities may face challenges related to accessibility, transportation, and participation in various activities. When working with people with physical disabilities, keep these pointers in mind. Communicate at eye level. When speaking with someone using a wheelchair for more than a few minutes, try to find a place to sit so you can position yourself at their eye level to facilitate comfortable and inclusive communication. Be patient. Individuals with physical disabilities may require more time to complete tasks. Practice patience and avoid rushing them. Allow them the necessary time to perform actions at their own pace. Clear pathways. Keep pathways clear of obstacles to facilitate smooth movement for individuals using wheelchairs. Ensure there are no tripping hazards, such as loose cables or cluttered areas. Finally, assistive technology. Be aware of any assistive technology or devices individuals may be using, such as mobility aids or specialized utensils. Respect and be mindful of these devices as they are essential to their independence and daily activities. Vision disabilities encompass a range of conditions that impact a person's ability to see and process visual information. These disabilities can vary in severity from partial vision loss to complete blindness. Individuals with vision disabilities may experience difficulties with tasks such as reading, recognizing faces, or navigating their surroundings. They may use assistive devices like glasses, magnifiers, or screen readers to enhance their visual capabilities or access information. Braille and tactile systems are also used for reading and communication. Some things to think about when working with people with vision disabilities. Introduce yourself. When approaching someone with a visual disability, introduce yourself and others present. Use verbal cues to indicate your presence and position. No assumptions. Do not make assumptions about someone's ability to see or use assistive tech. For example, only approximately 10% of individuals who are blind can read Braille, and the majority of individuals who are legally blind still have some small amount of visual perception. Describe surroundings. When providing directions or explaining the layout of an area, use descriptive language to help individuals with visual disabilities form a mental image of their surroundings. Include landmarks, distances, and any potential obstacles. Offer visual information. If there are visual elements or displays, provide verbal descriptions of what is happening or being presented. This includes describing visual aids, charts, or any other visual materials. Guide dog etiquette. If someone is accompanied by a guide dog, remember that the dog is working and should not be distracted or petted without permission. Use clock positions. When providing directions or indicating the location of objects or points of interest, use clock positions. For example, the door is at 12 o'clock. The chair is at 3 o'clock. This helps individuals with visual disabilities understand the relative location of things. Finally, obstacles. If you notice any obstacles in their path, such as steps or low-hanging objects, politely inform the individual and offer assistance in navigating around them. Hearing disabilities refer to conditions that affect a person's ability to hear or process sound. These disabilities can range from mild to profound, impacting the individual's ability to perceive sounds, understand speech, or communicate effectively. Individuals with hearing disabilities may use various assistive devices and communication methods to enhance their auditory experiences and communication. These can include hearing aids, cochlear implants, sign language, lip reading, or written communication. When working with someone with a hearing disability, consider the following. Get attention. Before starting a conversation, ensure you have the person's attention. You can wave your hand to establish visual contact. Face the person. Position yourself in a way that allows the individual to see your face clearly. Face them directly and maintain eye contact while speaking. If they are using a sign language interpreter, talk to the person, not the interpreter. The interpreter is not part of the conversation, and they may not even be introduced. Speak clearly, but do not over-enunciate or exaggerate your lip movements. Use a natural tone and pace of speech. Avoid shouting, as it can distort lip movements and make it harder to understand. Use facial expressions, gestures, and body language to enhance communication. These visual cues can provide additional context and help convey meaning. Just be careful not to be too exaggerated. Find optimal lighting. Ensure that the lighting conditions are favorable for lip reading, sign language, and other forms of visual communication. Avoid having bright lights behind you, as it can create glare and make it difficult for the individual to see your face. Use visual aids, such as written notes or diagrams, to supplement verbal communication. These can be helpful in conveying complex or detailed information. Be patient. communication may take a little longer with individuals who are deaf or hard of hearing. Allow them time to process and respond, and avoid interrupting or finishing their sentences. Respect communication preferences. Ask the individual about their preferred mode of communication. Some individuals may prefer lip reading, while others may use sign language or assistive technology like hearing aids or cochlear implants. Respect their choices and adapt your communication style accordingly. Ask for clarification. If you are unsure if the person understood you, or you didn't understand them, don't hesitate to ask for clarification. Speech disabilities refer to conditions that affect a person's ability to produce or articulate speech sounds accurately, fluently, or intelligibly. These disabilities can manifest in various ways, including difficulty with pronunciation, rhythm, pitch, or volume of speech. Individuals with speech disabilities may face challenges in expressing themselves verbally, being understood by others, or participating in conversations. They may use alternative communication methods such as sign language, augmentative and alternative communication devices, or written communication to effectively convey their thoughts and ideas. Keep in mind the following points when working with someone with a speech disability. Be patient and attentive. When communicating with someone with a speech disability, be patient and give them your full attention. Allow them time to express themselves without interrupting or rushing them. Maintain eye contact. Maintain eye contact while listening to someone with a speech disability. This shows that you're engaged and attentive to their communication. Avoid looking away or showing signs of impatience. Use active listening techniques. Practice active listening by nodding, smiling, or using facial expressions to show understanding and encouragement. Use nonverbal cues to indicate that you are following the conversation and value their input. Avoid finishing sentences. Allow the person with a speech disability to finish their sentences or thoughts. Avoid jumping in to complete their sentences, as that can be disempowering and disrupt their communication process. Ask clarifying questions. If you're having difficulty understanding something, ask open-ended questions or use prompts to seek clarification. Encourage the person to provide more information or use alternative communication methods if needed. Use alternative communication methods. Be open and receptive to alternative communication methods individuals may be using, such as augmentative and alternative communication devices, sign language, or written communication. Respect their preferred mode of communication and adapt accordingly. Avoid assumptions. Do not make assumptions about someone's cognitive abilities based on their speech disability. Treat them as capable individuals and give them the opportunity to express themselves fully. Avoid interrupting or overcorrecting. Allow the person with a speech disability to communicate at their own pace. Avoid interrupting or overcorrecting their speech. Focus on understanding their message rather than how they articulate it. Cognitive disabilities encompass a range of conditions that affect cognitive functioning, including thinking, learning, memory, and problem-solving abilities. These disabilities can vary in severity, from mild to profound. Individuals with cognitive disabilities may have challenges in areas such as comprehension, attention, reasoning, and adaptive skills. When working with those with certain cognitive disabilities, follow these best practices. Respect and patience. Treat individuals with cognitive disabilities with respect, dignity, and patience. Allow them time to process information and express themselves. Avoid rushing or interrupting them. Use simple and clear language. Use simple, concise, and clear language when communicating. Speak slowly, using short sentences and familiar words. Avoid using jargon, complex terms, or ambiguous language. Provide visual aids. Utilize visual aids such as pictures, diagrams, or written instructions to supplement verbal communication. Visual cues can enhance understanding and assist individuals with cognitive disabilities in following instructions or conveying information. Allow extra processing time. Individuals with cognitive disabilities may require additional time to process information, formulate responses, or complete tasks. Be patient and allow them the necessary time without rushing or pressuring them. Simplify choices. If offering choices, present options in a simplified and concrete manner. Limit the number of choices and provide visual cues when possible. This helps individuals with cognitive disabilities make decisions more easily. Break tasks into smaller steps. For complex tasks, break them down into smaller, manageable steps. Clearly explain each step and provide guidance and support as needed. This approach can help individuals with cognitive disabilities navigate tasks more effectively. Be flexible and adaptable. Recognize that individuals with cognitive disabilities may have different ways of processing information or completing tasks. Be flexible and willing to adapt your communication style or approach to accommodate their specific needs and abilities. Remember, every individual with a disability is unique, and their needs and preferences may vary. It's important to approach interactions with empathy, respect, and a person-centered mindset. By implementing these best practices, you can foster a supportive and inclusive environment for individuals with disabilities. Together, let's create an environment where everyone feels valued and welcome.